As we all know, the human immunodeficiency virus, as known as HIV, has ruined many of lives and also caused many of deaths. Here I have a visual aid on the HIV virus showing the stage of engagement of HIV virus. This is how many people are infected with HIV, and it is 1,106,400 people. This is how many people have been diagnosed with HIV, and it is 874,056 people. This is the people that are linked to HIV care, and it's 655,542. Here is the number of people that are retained in HIV care, and that's 437,028 people. And this is the people in need of the antiretroviral therapy, and that's 349,122 people. And here is the people that are on the antiretroviral therapy, and it is 262,217. And that is the people that are undetected, and it's 209,773. What is HIV? HIV is a virus a lot like the virus that causes the flu or the common cold. The difference between the two is that your body's immune system can fight off the flu or the common cold, but not with HIV. It's not that simple. HIV cannot be transported from person to person by casual contact, like giving somebody a hug, or it can't be transported like by mosquitoes or touching things that a person with HIV have touched. HIV was found in the 1800s, and there might possibly be a cure after 3 decades. We will discuss and learn 3 main points, and those points are how it was found, what was used, and will it be a cure forever? I'm sure we are all curious to know exactly what was used in this so-called cure for HIV. Researchers at Washington School of Medicine in St. Louis have found that bee venom in nanoparticles can kill HIV virus. It is proven that the melatonin in the bee venom can destroy HIV by poking into the holes that surround the virus. Nanoparticles smaller than HIV were mixed with the bee venom toxins. A protective bumper was added to the nanoparticle's surface, allowing it to bounce off normal cells and to leave them intact. Melatonin on the nanoparticles fused with the viral envelope, and the melatonin forms pore-like attack complexes and ruptures the envelope, stirring it off the virus. This revelation can lead to the foundation of vaginal gel to prevent the spread of the HIV virus. People who are diagnosed with HIV and start at an early stage of the treatment might be what they call a functionally cured. Researchers compared 14 patients with other people infected with the virus, including patients who are also early treatments but did not respond as positively. They identified various differences among the patients, such as including how strong their immune system was or stuff like that. We have heard what was used to find the cure. We need to know how it was found. There has been more than one treatment used for the cure, and after being in this epidemic for 30 years, there might actually be one that worked. One case was an infant. She was only 30 hours old, and doctors decided to do an early treatment after finding out her mother was HIV positive. After giving 3 of the drugs instead of just 1, and being on the antiviral drug for 15 months, her mother took her off of her mother stopped getting her treatment, and after 2 years, the baby was found negative for HIV. As well as the toddler, 2 men have also been cured. The men had cancer, and on top of that, had HIV. Well, after they got a bone marrow transplant, HIV can no longer be found in their body. Also, 14 French people are functionally cured. 10 men and 4 women were treated during primarily, also known as acute infection, and remained on the ARVs, the antiretrovirals, between 1 and 7.6 years. The median length was 36.5 months. All 14 have remained off ARVs for 4 to 9.6 years. 11 have maintained viral loads below 4 and 3 below 5 copies. As we learned about the cure, how it was found, and what was used, we need to learn if it's going to be a cure forever. Researchers show that the so-called cure that they found in the HIV virus may or may not be a cure forever. So for now, they're calling it a functional cure. Dr. Azer told BBC News that the findings suggest that anywhere between 5 to 15% of people treated are able to be functionally cured. He also says that they are not fully cured of the virus. It's more like a remission of the infection. In conclusion, we have discussed and learned about what we know as the functionally cure of HIV. We know what was used, we know how it was found, and we learned that it may or may not be a cure forever. Even if it's not a cure forever, it is a start for the curing of the HIV virus.